All right. This is another night with Nurse Messi Mary. As usual, I'm going to try and see. I'm just going to wait for people to come around. Hey, hello Dorian, how are you doing? Trust you're doing great. Thank you for coming and immediately clicking the like button. I see you. Let's see. Oh, let's see. So I'm just going to open the two as usual. Hello Isaac, how are you doing? Trust you're doing great. Trust you're having a wonderful time. So it's another night with Nurse Miss Mary, but today I have a popcorn. Here you can come and join me. So hi Isaac, how you doing? Trust you're having a nice time. So I'm gonna be taking questions as usual. Like I earlier said, you're gonna be seeing more of me, but probably at night. Yeah, majorly at night coming to take questions, okay? Before I go to bed. So that's what I'm doing. But today I've not completed all my bedtime routine because I have to go back and brush my teeth. Because I have some sweet popcorn here. So I feel like having something sugary. So I have some sweet popcorn here which I'm going to be taking and also taking your questions. So I put some in the bowl so you can come and join me while I take your questions. All right. Oh. Okay, so we have Isaac Boma. We have two Isaac here on today's live. We have two Isaac. We have Akko Isaac and we have Isaac Boma. How you are doing? Trust you are doing great. Good evening. And it's another opportunity to take your questions. Like I will always say, I am not able to take questions under the comment sections. So what I can do is to come live and take as much questions as I can. All right. So let's see what we have for tonight. If we don't have much questions, definitely I'll be going to bed soon. But if we have a lot of questions, I definitely will be able to take it. Okay. Actually, I didn't even know when I was trying to go live. I didn't even know when it just went live automatically. I didn't know I already clicked it to enter live. So let's just give. Doreen said, please, I need to book an appointment with you. Just send me a message on my Instagram. Send a message on my Instagram. Yeah, you can send a message on our Instagram and I'll send you the link to get everything. Yeah, Raj, I can read your chats. What are you trying to say? I can read your chats, Raj. So you can probably drop your questions or say whatever you want to say. So while waiting for others to join, Happiness, how are you doing? What do we have today? Okay, today is more or less like a question and answer section. Yesterday's live we talked about surrogacy, but today I think I'm just here to take questions. I don't really have any particular topic. I don't really have any topic in particular in my mind today. So I just came in to take as much questions that are going to come up from this live video. So yeah, I'm both on YouTube and Facebook. So we have Narcissus Akiski. Then we have Davido Louis Charles watching on Facebook. So Darren said, I'm not on Instagram and Facebook. How do you do this now? I don't really know how to go about this. Doreen said she's not okay. What's gonna happen is that I'll drop my email. I'm gonna be dropping my email, then you can send me a message through my email at nursemessimary.com, nursemessimary@gmail.com. So we have who do we have here? We have Innocent. Good evening, watching from Texas, USA. Thank you, Innocent, for joining us. We have Raj. Ma'am, where are you from? America? No, I am not from America. I am in Nigeria. I'm Africa, but I resided in the but I'm but I reside in UK, United Kingdom. So Bikash Ross said open, milk open. I don't understand what you mean by that. Um Raj said, reply me, ma'am. What's your question? Then we have Catholic Family Network said, greetings, ma. This is my first time joining you. Greetings, how are you doing? Trust you're doing great. It's nice having you on live. So this is not what I usually do. I usually make content based on the questions my follower asked. That's what I use to make content. So I hardly come live, especially at night, without my uniform to actually take questions. But I noticed that the questions on my videos are getting too, like, they're getting a lot. They're getting voluminous. And I don't really know how to answer them because I know people are waiting for me to answer their questions. So that's why I try as much as possible to come live. So if you know somebody that I've dropped questions on under my YouTube channel, so this is an opportunity on my live videos for them to ask questions and get their answers sorted out. So we have Helen Foluke. Good evening, us, Miss Mary. Good evening. How are you doing? Trust you're doing great. Okay. Then we have Ikede Dore. Please, like I said, ma'am, I'm not a I'm gonna send you an email. Do you use your email? Okay, ma'am, I'm an Indian. How to work in United Kingdom? I have no idea on how to work in United Kingdom as a software engineer. So I can't really give useful advice in regards to that. I am not a software engineer, so I can't give advice on how to work as a software engineer in the United Kingdom. I'm sorry about that, Raj. So we have big cash roll, big cash roll. I'm waiting for your questions. Definitely I will answer it when I see it. You don't need to beg. If I see your questions and I have answers to it, definitely I'm going to answer it. So that's why I'm here today. So just drop your questions on the comment section. I'm here to take as much questions as I can today. All right. For those that are meeting me first time, my name is Mercy Mary. I am a registered nurse and a registered midwife in Nigeria, but I'm currently practicing as an anesthetic and recovery practitioner in the United Kingdom. Okay. And I do a lot of health talk and health educations. But for the now, because of my schedule and because of what I have on my decks at the moment, I'm unable to show up consistently on my YouTube channel like I always do, taking your questions. So that is that is why I show up like this. Okay, so we have Abdullah about I have been following your lectures and from your teaching and from your teachings. I also teach my students and they learn a lot every day. Wow, that's great to learn. That is very, very great to learn. So we have Desh, and like I say, you're about to be kidnapped. Why am I being kidnapped? Why? I don't know about that. Then we have Raj said, where are you born in Nigeria, United Kingdom? I am born in Nigeria. I was born in Nigeria, sorry. So on my Facebook, so I'm doing live. So the live is both on Facebook and on YouTube, okay? So in case the eye coordination is up and down, up and down, up and down, just know that I'm trying to look at the two places. So we have Francis Male say, how do I work on delay ejaculation? Delay ejaculation. Did we make I think I have a video on that. I can't remember the sticks on that yet. I can't really remember what I actually tutored on that. See, let me check. Just give me some time. I think I have a note on delayed ejaculation. Just give me some time. Oh. Just keep your questions coming. The ones I can't really answer, I can't say I can make a video on it because I don't know how soon I'll be able to make a video on the ones I cannot answer. Okay. I can't really tell you that. Oh, my phone, this one is hanging, and I'm using both phones here. So, and the third one, it's just messing up. Just give. So I think that topic, can we put it on a hold, please? I will talk about that soon, but I don't know how soon that's gonna be. I'm going to see how I can talk about delayed ejaculation soon, but I don't know how soon it's gonna be. Okay, because I think I have a note, a write up or a lecture on delayed ejaculation. So I wanted to check and confirm. But this particular phone, I don't know what's wrong with it today. That's strange. Is this one going? Okay, I don't know what's wrong with the phone anyway. Okay, someone said, can you tell me your journey from Nigeria to United Kingdom? What problems you faced? Did it took a lot of money? Generally, relocation is a lot of money. Generally, relocation takes a lot of money. But I don't know how it's going to work out for people coming from India to UK. But generally, relocation takes a lot of money. You have to write some couple of exams as a nurse. You have to apply for jobs online. It's a whole long story. Okay. Is it possible for as a poor person to apply and work in England? If you have your certifications, you have what they are looking for, especially your healthcare workers. I think it's easy whether you are poor or rich. It doesn't really matter. You can also get a job. Raj, I think your questions are outside what we're talking about on nurses lecturing. So first of all, I'm not an immigration expert. I don't have ideas about immigration. I don't make content in regards to immigrations on how to relocate. So I am not in a better position to give you advice on how to relocate generally. Okay. So I'm not in a better position to give you advice. Nurses believe in God, but everybody has their own religions and who they believe in. Okay. Eunice said, I am in nursing school too. That's good. Congratulations. I believe very soon the journey will be over and you become a registered nurse soon. So we have Akimuda Shem from Facebook saying, good evening, nurse. Good evening. How are you doing? Trust you're doing great. Then we have Ebubechi Onora from YouTube. I have a regular cycle, but I found it difficult. I believe that's what you want to type, to conceive. What can I do? So in terms of that, Honora, you have a regular cycle. You're sure you have a regular cycle. Have you been able to know your ovulation day? Have you been able to know your ovulation day? Do you know when you are ovulating? Yes, you have a regular cycle. Do you know the actual date you are ovulating? And is your partner always around during that period? And if your partner is always around during that period, that's good and fine. So it's advisable for you both to go for checkup. Like you can tell your partner to like do a semen analysis. Then also you yourself do a general a test too. Sorry. So that's going to go a long way to help. All right. So that's what I have to say in regards to that. Because if your cycle is regular, you're sure that your cycle is regular, like you said, and then you know your ovulation date. So definitely you should tell your partner to also do a semen analysis. Let's find out, okay, if the semen is okay, the sperm count is okay, and everything is intact. That's going to give us what to do. Shay said, please, can someone with milk discharge who have not stopped after steam birth? Wait, please, can someone conceive when milk discharge have not stopped? Yeah, there's a possibility you can conceive when the milk discharge have not stopped. As far as you're ovulating, you are seeing your menses, definitely there's a chance of you conceiving. So even if the milk discharge have not stopped, you can also conceive. It's possible. So if you are trying to prevent pregnancy, you have to be conscious. And if you are trying to get pregnant, you have to do more. You know what I mean? So we have Eunice said, I'm going to be a lab technician, but it's very hard. Who said is a nurse? But you said you are a nurse. Are you doing both? Are you doing a lab technicians and also a nurse at the same time? That I don't understand. Here's a throw pillow. That I don't understand if you are doing a lab technician and also doing that of a nurse at the same time. That I can't really say. So, patient Aslip said, when will be EDD for someone that menstruate last in July? And how many months is the pregnancy now? Asking for a first timer friend. Okay, if the last time you menstruated was July, so we have August, September, October, November. What they normally do, let me tell you how to calculate it. So it's easy for you to know the EDD. If you want to calculate the expected date of someone's delivery for patients that ask the question, add 9 months, calculate 9 months to that person's date, then add 7 days. So if the person last saw her menses, the day the last menses started, maybe it was July 14, add 9 months to that July 14, then add 7 days. So that give you the day that the person is going to conceive, the expected date of delivering. Okay, so Shane from Facebook said, thank you, nurse. Thank you, you're welcome. Then Nini said, I have a problem with severe menstrual pain. Have you seen a doctor in regards to that? Just for seeing sake. Sometimes nothing is wrong. It's just your body releasing what is called prostaglandins. So that severe menstrual pain, sometimes there's nothing wrong with it. It's your body releasing prostaglandins. Why for sometimes it might be something that needs to be sorted out. So what I would advise, if the pain is really severe and is becoming really uncomfortable, it's advisable you speak with your doctor and get useful tests done. Wow, I didn't really know you can be a nurse and a lab technician at the same time. Ah, where is that school is? I didn't even know you can be a nurse and a lab technician at the same time. How are you coping and how many years course is that? A nurse and a lab technician. Yeah, I said I saw a doctor, but it was outside. He said it was dysmenorrhea, but the treatment is not helping. Sometimes what it just simply means dysmenorrhea is simply painful menstruation. It's just a big word, it's a big grammar. Dysmenorrhea simply means painful menstruation. And most times what they normally give is painkillers. You get some women usually have this severe pain, and it's as a result of their body releasing a hormone known as prostaglandins. So it's that prostaglandins that causes that intense pain most women feel during their menses. I'm quite of not uncomfortable today. Someone said, but please, I noticed small discharge coming out of my breast, and please, I saw my period on the 18th of this month. When we be my ovulation, let me know if I'm mistaken. Okay, in terms of onwara, to calculate your ovulation, we have to know at least 3 days, 3 months, for 3 months when your menses started. Like for example, we're in November now. We have to know when your menses started in. September, October, and November. So at least 3 meses, menstrual date, start date. So from there, we'll be able to calculate your ovulation date. So without that, I can't really tell you your ovulation date just from telling me that you saw your period on the 18th of this month. So to be able to get it, I need at least 3 start date of your meses. With that, we're able to use the calendar to calculate your cycle to know if you have a regular cycle. So if you have a regular cycle, we will not trace down your ovulation date. But if you don't have a regular cycle, it might be difficult for us to actually track down your ovulation date. Okay? Oh, you said it's 3 years course. That's good. It's a 3 years course. Nurse is a 3 years, and I'm almost at the end of my second year of nursing. But I just started my lab classes, so very much busy. Okay, I wish you all the best and congratulations. So we have Kristen said, I have an issue. I smoke colos and I want to quit. But every time I stop, I continue. Do you have any recommendation to that? Personally, I don't really have any recommendation. But what I can say is that for you to have the mindset that you want to quit, that's a good step. Okay? And if you're in a country where you can easily get therapists, where you can easily get help to help you stop smoking, I would advise you go and get those help. Speak to someone and let them know. There is a video I made on how to help one there's a video I made on how to help people stop addiction, be it masturbations to pornography, masturbation. So I think that video will go a long way to help. Oh, I might end this live soon. I don't think I'm ready for this live today. I might end this live soon. So we have Akko Isaac said, please ma, I'm suffering for asthma and I've been taking a lot of medications, but I'm still suffering from it. Please, is there any treatment to help? First of all, you said you're taking your medications. That's a good one. What in terms of, I would like you to work on your diet. If you are smoking, you're alcoholics, you have to work on cut down. But if you are not, I would like you to work on diet, stay in a place that is properly ventilated. Don't go to overcrowded environment because that may actually stimulate your asthmatic attack. So always keep your inhaler with you if you are using inhalers. Then drink a lot of water. That's also going to go a long way to help. I think I'll just screenshot this and probably, I'm not showing you when I'm going to make a video, but hopefully soon I'm going to make a video for that because that's something serious that needs to be talked about in details. So outside your medications, what can you do to help with asthma? I don't know if I've been able to answer Akko Isaac. All right, I'll be going offline now. At least I've tried. I've been able to spend like 24 minutes, which is a good one. And I'll be able to answer some questions, all right?